morning, everybody. It's a beautiful Monday, and let me just say thank you to Cabrina and Rome for assisting us this morning. Today we have a wonderful topic for our listeners out there, and we have a special guest. He's no stranger to the Sufra community. Today we are speaking about appreciating our pharmacists. And many times we don't understand what pharmacist has to do, and sometimes persons tend to complain, the pharmacist is taking too long, they're there since morning, but there is a process, and in reading all about a pharmacist and what they have to do, you know, it gave me a new insight, why we have to be patient and why we need to take time and listen to our pharmacist directives and instructions and how important it is. So today, June 16th, is Commonwealth Pharmacist Day with the theme, 6 continents, 1 profession, together we thrive. So it's just not about that one single pharmacist we see here today, but it's all pharmacists throughout our Commonwealth countries, which is a very, very good thing. One mentality, one level of thinking, and you know, trying to raise the bar and trying to, you know, get in our times as it relates to modern technology. So many times we see our pharmacists, we only see, we bring in the prescriptions, they dispense, but it goes far beyond that. And I never realized this until, you know, when I saw a presentation and I read up on exactly what a pharmacist is supposed to do and everything that they're supposed to go through, you know, it really had me. And, you know, one of my dreams was that my daughter could become a pharmacist. And now I'm saying, oh my God, that is a lot of work. A lot of work for that little bit of money. So, without further ado, I would let our special guest introduce himself. I think he's no stranger to our Sufra community. So, Alvin, go ahead.
Yes. Am I on? Am I on?
Yes, you are.
Okay, yes. So my name is Alvin Charles. I have been in Sufra. Well, I'm originally from Canaries, but I.
Shift a little bit, Alvin. We don't see you on that.
Okay. I think it's the other way.
The other way around?
Yes.
Yeah.
This. No, the other way. The other way. The other. Continue. No, Gabriel. This.
Okay, wonderful.
You still have to move it again. All right. So yes. So sorry for this. All right. So my name is Alvin Charles. I the pharmacist in Region 6 that comprise Sufra, the Sufra Basin, the Sufra Hospital, as well as the Schweizer Basin as well. Have been in Sufra since 2001. So I think that will be my 24th or 25th. Well, going to 25th year in Sufra. So I guess I'm a Sufra native.
Yes, you are.
Yeah. So we work from our basis at Sufra Hospital. So we do both. I do both, in a sense, hospital pharmacy and community pharmacy, and I'll explain that a little more as we go on. But I guess you will ask what is pharmacy?
Yes, definitely.
Yeah. So pharmacy is a science. It's a profession, yes, but it's a science. It's basically the science and the practice of preparing and dispensing drugs and medical devices. All right. So as you said, it is a science that involves a lot of scientific work. That's why we have to go to school to learn about medicine, to learn about the chemical structure of medicine, how medicines are formulated, and what impact the medicine has on the body. All right, this is important. And so what you basically see, you would see a pharmacist in the pharmacy, and you see him reading a prescription and pretty much picking up drugs on the shelf. But beyond that, he needs to have a scientific background to know and understand how the drug that he's about to give will impact the individual, and be able to counsel them as to the side effects that they may have, or the proper use so that they would get maximum benefit out of it. All right, so it is our responsibility as at first when we started, we used to be called druggists or or you call the chemists. All right, today we don't really use these terms because pharmacy involves more than just the preparation of drugs. It really has to do with how does the drug benefit the patient, right? And today a lot of pharmacists are not directly involved in the manufacture of drugs anymore. You have these big companies that do that. Of course, pharmacists are on the panel, all right, in terms of the way that the drug is discovered and how they develop the drug. But we get that product after it is done to a large extent, but we still need to know about the drug so that we know what is the drug used for, why is the person being prescribed that drug, because the patients usually ask us. Now sometimes they would not ask the doctor. The doctor, they would come to complain about what they experiencing, and the doctor begins to write. But some patients do ask the doctor, but a lot of patients, they just come to the pharmacy and they say, the doctor gave me this, and they expect you to interpret that, what the doctor has written for them. So it is necessary that we know what the drug is. And as you know, it's an expanding field. So they discover new drugs and they formulate new drugs. And so you need to keep abreast with, ongoing trends and new information. Drugs sometimes are reclassified so that it was developed for one reason, but now it's being used for other reasons. All right, sometimes it's official, sometimes it's off-label. That is, they have as they were testing the drug, they recognize that it has other benefits, right? And so it can get approved for that. But other times at the doctors, it's not, when the drug was approved, it was not, they had not indicated that it was good for a particular reason, but over time they recognize that it's beneficial to something else. And sometimes doctors use it for that purpose, even if it is not officially given or licensed for that purpose. Over time, they can do that. They can relicense the drug so that it can be used for other reasons. For example, a drug like Viagra that we know very well, right? Viagra was first developed as a for high blood pressure, right? But no one today uses Viagra for high blood pressure. It's used for impotence, right? Because incidentally, the impotence is the side effect of the drug. I mean, the potency. And so they recognize, but the side effects seem to be more beneficial than the effect itself. So let's relicense this drug for that purpose, right? So these things happen, but this has to be done professionally in the lab and so forth to ensure that the drug is safe for the purpose for which it is being used. Yes.
Okay. So, before we go on, I want to ask you, what made you want to become a pharmacist? We don't really have many pharmacists in St. Lucia. Well, we have a few, but there is always a need for pharmacists. So what kind of motivated you to become a pharmacist?
Okay, well, indeed, before I answer that, indeed, we have need for pharmacists, very, very much so. And I could do with some help down in Suffolk as well. Yes, but way back at school, my brother, he went to school before me. He was 3 years ahead of me, and he did the sciences at school. And when he came home, he would talk about biology and chemistry and all of these things. And at school, I love science as well, the general science and so forth that we did back in primary school. But then I gravitated towards it because I love what he was talking about, physics and agriculture and everything of that sort. So I went on to choose these as my area. And I did very well in it. I had a knack for it, chemistry and biology and physics, mathematics, right? So I was in Form 4 at the time when I went to the Canary Health Center to see the doctor. Mm-hmm. And on my way up, I left, and then I was hitchhiking basically. At the time, that's way back in the 80s. And then the person that actually stopped for me was the person that I had just seen. That was the pharmacist who was at Sufre, who used to do the clinic at Canries, and he gave me a lift up from Canries to Belvedere, and we just started speaking about the medicine. And that was the initiation. I just love what he was talking about. I mean, he had just prescribed, he had just given me drugs to use, and then that little initiation about what he does, what's the drug used for, and everything of that. So that was the birth of my interest in pharmacy. So when I left school, I applied for pharmacy for the government. At that time, you become like an apprentice, right? You come to the Victoria Hospital. And then when I applied, they told me the positions were filled at the time, but still apply. And if I can't enter for pharmacy, maybe I could do radiology or something or the lab work or something in the area. Because I had done the sciences, I really wanted to do pharmacy, but lo and behold, that as the free position was made vacant because the free students who were there at the time, that same summer, they got a scholarship to go to school, all right, in Guyana. And then the free position became available. So I was redirected to the pharmacy area. We spent some time, of course, from that time, it has been very difficult to get scholarships in that area. You get scholarship in medicine, you get even sometimes in nursing, but to a large extent, the government was not giving any scholarship in pharmacy. So after some years, I think it was 2 to 3 years, we made our way. I said we because I have a colleague who works in Vieux-Fort who also went to school with me. And we got through to Barbados, the school in Barbados, Barbados Community College. At that time, we did a 3-year course and we got an associate degree. And subsequent to that, we went to Jamaica, the University of Technology, to complete our degree. Yeah, so basically that's the birth on the interest for me in pharmacy. Initially, when I was going to school, my father always wanted me to become a doctor, and he was working towards that. But when my father fell sick when I was 10 years old, I never recovered. So that plan, kind of, the finance was not there for me to go on further. So we made do with where we could have reached at the time. But as I went to school, I realized they're not very different. They're not much different from pharmacy and medicine. Pretty much we do some of the core courses together, and then in the final stages we just branch out into separate areas. But it's pretty much has to do with medicine and how it impacts persons and how it helps better persons' lives.
Yeah. Well, the reason why I asked that question is what we find is most times we don't get many people interested in the field, especially our young persons. So having said that, I hope that can motivate in our young persons against all odds, that if they really want to pursue the career, I mean, there are schools within the Caribbean that you can really go to, and it's 7 years to do your first degree?
No, 4 or 5 years.
5
Well,
years?
yeah, but now they shrink it down to 4 years.
4 years?
Yeah, because they do the entire bachelor's course at this time. At first it was, you had to do an associate or a diploma, and then you had to upgrade, but now they do the entire course. So you can get the 4-year course in Barbados, you can get it in Trinidad. There is a school, University of Guyana. Mm-hmm. There is the University of Technology, where it's offered also. From there, you also can move on to the doctoral degree in the PharmD.
University of Technology in Trinidad?
In Jamaica. Jamaica, yes. Trinidad University of the West Indies offer pharmacy. Also in Grenada, TA Marisho Community College. So there are schools now in the Caribbean that offers pharmacy that is within our reach, right? Sometimes there is the scholarship that to Cuba, but the course that in Cuba is not pharmacy per se. It's not pharmacy. It is pharmaceutical science, and it is it's different. It doesn't cover some of the core areas in pharmacy that is needed to be a practitioner, right? The pharmaceutical science concentrates a lot on manufacturing and the formulation of drugs, and you know that. Cuba has been under embargo for so long, right? So they had to make their own medicine. So their students are designed, the course is designed for a student to learn how to actually manufacture, which is kind of different because, to pharmacy in that we need to not just, we are not really involved directly in the manufacture of medicine, but the use of medicine to the patient and the dispensing of medicine and the consult that is necessary as the person use the medicine. Right.
Okay. So, Alvin, having said that, there are different fields in pharmacy. I know all we see in pharmacy is come in, get your prescription, come to the pharmacist, and the pharmacist dispense the medication. But there are various fields in pharmacy. Can you just enlighten us about the different fields of pharmacy, of a pharmacist, and what can they do, the different areas they can branch out into, and so on?
Yeah, so we could start with the community pharmacist, all right? Basically, you work in a retail pharmacy, like M&C, you know, or Marcy or one of these, right? You directly help customers with your prescription and you give them advice, right? That's one. You can work in a hospital setting, right? Soufrière, Castries, St. Jude's. You not only have that community aspect where you serve patients, but you also interact with the other health professionals, the doctors, and also the clinic, the nurses, right? Because patients who come in for emergency care and so forth will not be the same that come in the community setting. So, so that's another area. There is clinical pharmacy, which is specialized. That's when you move on to the doctoral level, the PharmD, and you work directly with the doctor, the specialist, in helping patients with their care. These, of course, a doctoral pharmacy has a higher level of knowledge, and they are able to help adjust and optimize the patient's therapy, so that things like when persons are, let's say, a kidney patient, all right, the amount of drugs that they need, depending on how the drug is eliminated from the body, would have to be calculated and calibrated because of their weakened state. Basically, their kidney is not working well anymore, right? They're not healthy, and so there will be a retention of the drug in the body, right? Because it's not being eliminated properly. If the person has a liver problem, the same way it's not being eliminated and metabolized properly. So that the drug, a 5 milligram medication that would be good for a normal person would be an overdose for somebody who has end-stage kidney failure, right? And so the clinical pharmacist would do the calculation that is necessary to know how much of that drug they should give to acquire the same therapeutic level, but not cause toxicity in the person. So these are a little higher, and they spend a lot of time with the cancer, in the cancer research and cancer oncology and so forth, you know, because these are very, very dangerous drugs, and toxicity is something that can kill you, right? So that's clinical pharmacy. There is the pharmaceutical industry itself, working with the drug manufacturers, right? Engaging in research, discovering new drugs, right? And developing new drugs, right? That's why, and these concentrate a lot on the chemistry part of pharmacy. And if you don't like chemistry, you really can't go into pharmacy, because it's basically pharmacy combines chemical science with health science, right? And now chemical science on its own, persons who are chemists can go into development of drugs, illicit drugs. These are scientists, these are pharmacists sometimes who develop these drugs. I mean, those rogue scientists, I would say, right? Those that go into the formulation of bombs, making bombs, right? That's chemistry, right? And a lot of the anything that has to do with chemicals and how they interact, development of paint, right? A toothpaste, right? Hair products. All that is chemistry, but that is not where pharmacy is. Pharmacy, cosmetics, right? So all of that, that's a chemist, right? You can go into that, but the pharmacy basically brings the two together and how we can make a drug that literally goes in the body. And when the drug goes into the body, kind of, you don't have control over it anymore, right? So that's why you have to formulate in such a way to know where it will be the binding site, or how protein in your body affects it, how the fats in your body affects it, how your pancreas affects the drug, your stomach. So all of that, that's why we do the 5 and 7 years of study, to understand all of that and the interaction that takes place between that chemical that could be poisonous, but how you can use it in such a concentration that will be beneficial. All right? So that's basically the core of pharmacy. Of course, you can go into the regulatory affairs, where you ensure the legal standards, right? The benchmark, what is safety and so forth, and how the qualification of the persons who are practicing and dispensing, right? So you can do that, as well as you can go into academia and research. So you can go into the teaching aspect, right, where you teach you train and you teach other pharmacy, and also doing the research that is necessary and the ongoing research. So there are a lot of fields that you can go into as it relates to pharmacy. Yes.
Okay, so, some persons, they say, I want to become a nurse, I want to become a doctor, but sometimes when they into the profession, they have that knowledge, but yes, still, Alvin, what I find is that, Mr. Charles, they don't have that personality, they don't have that, yeah, you know the stuff, but there is some other aspect that is lacking.
Yes.
And, sometimes you need the skills and the traits. What do you think are some of the traits and the skills that you need to become a pharmacist? Because anybody can be a doctor, anybody can be a nurse, anybody can be a teacher. But there is certain things that you have to possess, like, personality and so on, to help out, bring out what you have learned.
Yeah.
So what do you think are some of the traits and, skills that a pharmacist should possess?
Of course. Okay. So number one, you would say, okay, you need to have knowledge, right? Knowledge is important, right? So you must have a scientific knowledge. You must have a strong background in chemistry, in biology, in mathematics. Mathematics. Yeah. Because many times we have, for example, we have to recalibrate the drug in order to dispense it. The child, because it's a child, and the age of the child, there's a limit that the child can use. But the preparation that you get, right, may be higher, maybe for a child that is 6 years. How do you know how much you should give to the child that is 4 and 3 and 2, right? So you have to have maths to be able to work this thing out and know if it's a fraction of it and how much percentage of it that you have to give. So maths is very important. Chemistry obviously is important. That's the bedrock of drugs and how it's formulated and how it works. The biology, how it works in the body, your body part. So the scientific knowledge that's key. You need to have good communication skills, right? Because the pharmacist is the last professional that the patient see before they take that medication, right? So whereas the doctor, they've spoken to the doctor, and then the doctor gave them a prescription, then they come to the pharmacy to get it filled. After that, they take the medication, right? Now, supposing the doctor had made an error, maybe what he intended to type is not what came up or whatever, right? Maybe he was having a difficulty, and then he put 2 drugs that are not compatible with each other. The pharmacist should be able to recognize that. So you need to have drug knowledge, all right? As a matter of fact, you're the expert on the drug. So you need to know which drugs are not compatible, which ones will have interaction, which one can combine to form a poison, right? You need to know that. And to call the doctor and say, I noticed there is an error, or I noticed, is that what you intended to write? And the doctor would say, oh, man, thank you for pointing that out to me. We are professionals, right? And we respect each other. And so they do make error. And we can make error as well. We can make an error. But you don't want because you're the very last person to see the patient, you hope that you will be extremely careful, because after you, they may not go to anybody else before they take that medicine, right? And sometimes they may go to the doctor and say, I was given this, and the doctor would call you up and say, did you notice that you gave? I did. It happens. but you try to minimize it as much as possible.
That is why
Right?
the persons need to bear patience when
Yeah,
they come to the pharmacy.
that's true. And I always tell them, I do not run a grocery store. I don't just pick up 2 pounds of sugar of the shelf. I have to read the prescription. I have to ensure that there's no incompatibility with the prescription, right? Before I actually dismiss. And secondly, I have to prepare and maybe compound or even prepare the prescription, and then check it over again before I give it to you, right? And then I have to communicate it well with you. Some person like in a hurry, I know I can read. Yes, everybody can do that, but maybe you can. But there are certain instructions that may be necessary, right? For example, if I tell you take the medicine before meals, all right? What is before meals? What time is before meals? All right? Now, what you find a lot of persons doing, oh, but I have to take my medicine. They already have their breakfast all aligned here. They're sitting there, I have to take my medicine, and they take it. And then as soon as they pop the tablet before meals, then they start eating. That's not what before meals means. Before meals really means on an empty stomach. So if you're going to eat directly after you take the medicine, that's not an empty stomach. You're just combining the drug and the food together, right? And the food may be interacting or binding with the food, and you don't get any effect from it. So
And that's a common mistake.
yeah. So when we say before meals, it's like a vague term, but the idea is that 1 hour before you eat, sometimes a half hour, or maybe 2 to 3 hours after you eat, so that your stomach would have been emptied by then, and so there's no interaction that takes place. All right? Somebody told me once, what does it mean? Keep it on the fridge. You tell us, it's just the way that we speak. We say keep it on the fridge, but he came back. He said, "You mean on top of the fridge or in the fridge?" Of course, it's just a vague way that we speak, but it really means in the fridge. When you say keep it refrigerated, what part of the fridge do you keep it in? The freezer compartment or the bottom? So these things are important, right? That persons know and they are aware of. Keep it out of the reach of children, right? Where do you store it? Keep it in a cool place. Prevent it from getting direct sunlight. These are important because some drugs interact with light and they can break down the structure of the drug. So that is important. So we are talking about the communication skills. You need to be able to communicate the way the drug ought to be used to the patient, so that the patient use it and they maximize the use of it and they get the maximum benefit from it, all right? So that's important. If you do not have good communication skills, some persons would not feel comfortable, or they would just grab the package and go right? But sometimes you can see that an individual just by, as you're preparing the drug, you also sometimes can have a conversation with the patient. You may see on the prescription something that seems to be off. Like, we give medicine for usually 30 days, right? And the reason that we do that is so that you can help maintain proper compliance or proper adherence to the drug. If persons sometimes forget, sometimes some persons are reluctant, some persons do not know why they take the medicine and they kind of put it aside. And you notice that maybe one is finishing, the person's coming for one, but they're not taking the other. You have to be able to observe that and say, but hold on, we gave you medicine for diabetes and pressure, but you come for the diabetes but not the pressure, why? And be able to ask them, not intrusively, person's personal life, but to be able to communicate with them and to find out what's going on. Now, it may be that when they take that medicine, they're getting a headache, right? And they just put it aside. They may not know why it's for, and they said, well, I've never seen this one, and a lot of time persons just talk about the color of the medicine, especially the older ones. They may not be able to pronounce the name, so they said, I had a brown one, but now you gave me a white one, so I don't know what's that, I'm just putting it aside. So all of that information you need to be able to gather from the patient. So that communication is important, and to gather information and to communicate to the doctor as well, because if you notice the person is not adhering, you want to pass that information on to the doctor so they know how to consult them the next time they come to the visit, or maybe even call them up, because their situation could be getting worse, right? So that's important. Problem solving, of course, adjusting prescription for patients with special needs, and we've spoken about that. Attention to details, which is what I was just talking about, ensuring the correct medication is given at the right dose, and being vigilant to see if the person is adhering to their protocol, right? And the ways that you can counsel them because you need to give them a reason why to take it, right? Because they don't want to take it. They think that's poison that they're putting into their system, and there's so much pills, as they say, you're just going to contaminate their system. So why should I take it, right? What is the benefit of that medication to me, right? And if I don't take it, what complications that could happen, right? How I can make my situation worse. So you need to be able to have the drug knowledge to be able to tell them. Also to be able to tell them about what should they expect, right? So I used to have, especially the asthmatic patient, that's long before we knew anything about COPD, right? Asthmatic patient would tell me, they usually take the two inhalers. One is a steroid, Bicotide, and the other one is a beta agonist, right, to open the airway so that they could breathe properly. And they would tell me, well, this one works, but that one don't work. And I told him, do you know why do you use? So he said, yeah, when I take this one, I'm still wheezing. I'm still coughing. And so they would come a lot for the what we call the Ventolin, right? And they keep repeating the Ventolin all the time, and you're like, but what about the Bicotide? Oh, I still have this one. How is it you still have it? Are you taking it on time? Are you taking it regularly? Then you find out that they have not been taking it because to them, when they take it, they don't feel any different. But then when you explain to them that the Bicotide is not a reliever, it's not to relieve you of the symptom, it's to try to prevent the symptoms, right? So you have to take it to prevent you from having to get into that crisis. But because they have not been taking the preventer, they keep coming, they always get into crisis, and so they happen to take the reliever. When you explain that to them, they say, oh, now I know. That's why I didn't used to get this episode so often. But now I'm getting because I have not been taking the one to prevent it, right? So when they understand that, then they better manage their medicine. I need to take this one every day. This one I carry with me because I may have a need for it, and then I will use it. So this information is important, and so pharmacists is very key in helping persons understand that. They need to have a good ethical, I would say ethical background, because ethics is important. Because you need to maintain patient's confidence and confidentiality as well, because you are interacting with the patient. Person's medical condition is a personal thing. That's why the conversation they have with the doctor is not for you to know, right? Nevertheless, when they come with the prescription, even if they did not speak to me, but I knowing what the drug is for, have a good idea what they have come to the doctor for, right? It may be that they need some lifestyle coaching, some maybe just a word. If I see a patient who comes to the pharmacy every week for the morning after,
oh yeah,
they would not have gone to. They would not have come to the doctor, right? They just come to the pharmacy.
Yeah.
But it's something. They using the medicine as a contraceptive. But there is a limit of how much you can take of that medicine, right? Very, very powerful medicine, and could be very, very toxic, right? So you have to be able to concentrate. For one, they having unprotected sex, right? The fact that they come in for morning after, it means that they have unprotected sex.
Yes,
and exactly. So, but they're concerned about getting pregnant, all right? But what about the other STIs, right? HIV. And all of these things. So you need to be able to pick that up and to say, come, I need to have a conversation with you, right? And you pull them up in a secluded area on the side, and you just speak to them about it. It may be that they're going for some depression, right? And things of that sort, and alcohol abuse and all of that, drug abuse and so forth. So these are important, but when the person speak to you about their concern, they don't want everybody in the institution. For example, I deal with the ARV, the HIV patient as well, right? But you will never know that after the person leave the pharmacy, what they have is an ARV. Yeah. It has to stay confidential. Yeah. Because the moment that somebody knows that this person came there to get antiretroviral drug, that means they have HIV, you know what happened, the stigma in society, right? So I need to be able to speak to the person, treat the person as if they're as everybody else. Yes, yes. Even if their partner scheme, it's not for me to disclose to them what the person has or what medicine that they're taking, right? And even the person, I noticed my husband is taking this, what is that used for? I can't tell them, right? If the partner wants to tell them, they can, but it's not for me to do, right? So this is important. So your ethical responsibility is key, right?
Very important.
Yes, and sometimes also you work in the private. It doesn't really happen in the hospital setting because it's kind of government, but your boss wants you to make money, right? And you may be thinking, okay, we need to sell the more expensive one because that's how we'll make the faster buck, right? But that patient can't afford the more expensive one. So you have to explain to them that we have a generic type. What a generic is, it may not be less in potency, it may just be done by a different manufacturer, all right? Because what you know is that when a company develops a drug, usually it takes about 10 years to develop a drug. Research scientists and everything you have to pay. So they give you a patent, right? That might last for about 10 to 20 years, so that you can recoup that money that you spend in the development. So you have the drug and you have the brand, and that brand that company is the only one that can make that drug for that period of time. But after the patent is over, then any other company can make it, and now the price goes down, right? So you'd say, but this one costs such a, I remember when fluconazole, right? That pill, the one single tablet you use for the
That's really expensive at
yes,
the time.
50 odd or something
Yes,
dollars just
I
for one
remember
tablet.
purchasing it, yeah.
And now we have fluconazole for $1.
Yes.
Yeah, and it's no different. Now, if you don't know that, if it's my business, I'm going to sell you the diflucan.
Yes.
Because I just made $50. Right? And you may have seen the ad on TV, you're watching Americans, and you see that you came to ask for diflucan. Now I could tell you, and then you say, oh, you don't have it, and then you walk away. But I'm like, but I have fluconazole. Oh, but that's not what I saw on TV. But let me explain to you, that is the same drug. The diflucan is just the patented one. Right?
My experience 2 weeks ago was I went and buy a facial product.
Yeah.
And then I'm saying, but why is that $100 and something?
Yeah.
When I got it, in another pharmacy for $30 something, and that pharmacy we don't sell generic
Oh, just branded, yeah.
Just brand alone. It was $100 and something
Yes.
for the facial stuff.
Right.
When I could have gotten it in another pharmacy for $30 something.
Right, and
so
you must have a conscience, as much as the person. If the person can't afford the more expensive one, then you could in many cases you can substitute the generic one, and the person will go home happy. Of course, you need to have empathy. Patients come to you, and you notice that you're not taking the medicine properly, and they come the next time in 2 weeks. A medicine you give them for a month, they come 2 weeks, and then you notice that. It could be because they're getting it free to just come in often and just, not doing anything. And sometimes, honestly, some of those individuals pass away, and then their relatives say, I saw my mom has stacks of insulin syringes. I saw she have all of these things in her fridge. And she has so much. She have just been taking it more often than she needs to, because she said, I never want to miss out, right? and so forth. So, but then how do you counsel this individual? Do you shout after them? Do you, sometimes you have to be stern with them, all right? But you still need to have that kind of skill to be able to understand they're old, they may be senile, they're forgetful, no one is there to help them, they have other things to worry about, their children giving them problems, so they're not focused on their medicine and so forth. So you understand that and you work with them. Time management is important, of course, because persons who come to the pharmacy, they are usually not well, right? In some instances, they're not well. So that when they have to stand on a line for a very long time, it's different from a healthy person. And even the healthy one get agitated and so forth,
Oh,
right?
the healthy ones, that's their profession. They never have patience to wait.
Exactly. And sometimes you have to all observe that the stronger try to take advantage of the weaker,
Yes, the
right?
young and
So that old
vibrant
lady, you
ones.
call the name and she's kind of falling asleep and she's not even hearing. That other one say, I didn't see nobody there. Did they come for it, right?
It's
It happens
true.
all the
I've
time.
been in the pharmacy and that happens.
Yes, all right?
And where is your number?
Yes.
You not number this,
Yes,
and
yeah.
they try to cover it up.
Yeah, exactly. So yeah, so you have to work with time to see how you can manage and try to. But at the same time, the medicine it's important that you prepare the right drug and to dispense the right drug. So the patients have to understand that that is important because safety is primary, right? It's not just taking medicine, but how does it impact you? Am I giving you the right medicine? If you ever been to the pharmacy and you pour out some tablets, you see a lot of them are just white. A lot of them are round, sometimes the same size,
Yeah.
right? Sometimes there is nothing written on them, so it's just, if you're not careful, you can easily mix up these medicine.
I
And
always wonder
sometimes,
how you can identify which
yeah,
is which.
exactly, not only the looks of it, but also the name. Some of these drugs are similar in names, right? So you see the doctor and the prescription, it looks like, is it this or is it that? Sometimes you have to ask the patient literally, what you came to the doctor for? Because what you've seen on the paper it's in between. You're not sure if it's clonazepam or all of these words that start together, that sounds alike and so forth. And so you have to be extremely careful that you're getting the right drug. And if you're not sure, you call the doctor up, right? If you can reach him. And if you're not sure, if you can't reach a doctor, you literally can't give it because you don't want to make an error, right? Right?
What I realize in some of the private pharmacy, they have a sign and it says, allow the pharmacist 15 minutes
Yes.
for each prescription.
Yes.
And I recently saw that. I was up north and I recently saw it again. And I'm saying, when we come to our local pharmacy in Soufrière and other places, some people come with 3 or 4 prescriptions
Yes.
at the same time.
Yeah.
But yet still they expect to come out of there
In
within
50
the 5 to 10
No,
minutes.
yeah.
Because-
It's 15 minutes per prescription,
Per
really,
prescription.
right?
So-
But again, sometimes you try to restrict how much one
many?
person can, because they hold up the line, and other persons are waiting, right? And so we try to do that, but sometimes it's chaotic. It's
Chaotic.
yeah.
So
yeah.
imagine, I just want them to know 15 minutes per prescription. So if you come in there, it's like, you already 30 to 45 minutes. So you're holding up
You're holding up everybody else,
entire-
exactly. And
Yes.
what's there, they take now, when it's their own, their household, I mean, they have and their kids and so on and so forth, you can't send them out,
No.
right? But then they take for their relative and they take for that friend and they have one number one, but then they have about 5 prescriptions. So while they think that the pharmacist is wasting time, but he's processing 5 prescriptions that probably would have taken 15 minutes or even
Each.
more, right? And so they don't understand that. And then, so we try to restrict that and try to help persons to work with the system and be considerate of others, right? And that is important.
I
Yeah.
tend to agree with you,
Yeah.
Alvin.
Now, of course, if someone is interested in pharmacy, they are studying in school, they are at O-level at secondary school, what are the subjects that they would need to concentrate on to become a pharmacist or even a doctor?
Yeah.
Some persons just do integrated science and they say, well, I had to do one science, so I just chose integrated science, but that's not going in depth enough, right? Your science knowledge is not, because you might more like be concentrating on business or languages or whatever. But from high school, you need to focus on the sciences, right?
Yeah.
Chemistry is key. Biology and maths are necessary. Physics can help, all right? But these chemistry, biology, and mathematics are very, very important. Of course, if you, in the Caribbean now, the benchmark for practice of pharmacy is a bachelor's degree.
Okay.
Yeah. It used to be that way back it was like a certificate, right? And then that moved on to the diploma, right? But now the benchmark is the minimum basically is the bachelor. So you have to know that you need to get further study. And because we don't have a pharmacy school in St. Lucia, then you need to go outside, right, to get that information. You cannot do a pharmacy course online. you have to be in the classroom.
You can't even start it online?
Well, but you have to be working with a school where they do the online stuff. But usually it is when you're doing upgrades, right? Let's say you already gotten an associate degree or diploma and then you want to upgrade, so you can do the online course. But I do not know that there is any school right now that offers completely online in the Caribbean. You have to be institutionalized. Because some of the things that you have to do, you have to be in the classroom setting, in the lab and so forth, because it's science, right?
It is,
yes.
because I did medical entomology, and there was no school within the United States, European countries, that was offering medical entomology at the master's level online.
Wow.
You had to be in the classroom.
You had to be in the classroom.
There's a lot of labs and
Yes.
so on. So they were not permitting you to do it online at all.
Exactly. You need the practical,
guess that's
because
on
it's
the
practice. Pharmacy is not just book work, it's practice. So you need to be able, how do you compound this medicine? How do you make, at one time we used to literally have to mix the ointment.
Yeah,
And make your wheat fill ointments, and you make your thing. Yes. Yes, and how you had to dilute a certain concentration. So you have a 1%, but the doctor needs a 0.5%. How do you compound it so that it will not affect the child's skin? Because kids, the skin is more sensitive. The absorption is more, so, and they can get toxic much faster. All right, so all of these things, you need a lab for that. I remember at school in Barbados, we were working with some drugs that affects the heart, adrenaline. When somebody is going to heart attack and so forth, they give them that boost so try to get your heart started. And we literally had to catch a frog and bring it into the lab, and we had to immobilize the frog. We had to pin the back of the neck where the spinal cord goes. So the frog was alive, but it was immobilized. And we had to inject it with different medicine to see how it affects the heart. We literally had to cut open the frog in the lab and watch when you inject the medicine, how it affects the heart rates and the beat and the heartbeat and so forth. Unfortunately, afterwards, we had to kill the frog because we had already immobilized the frog. We had already broken the spinal cord, so the frog would never be able to walk again. And that was a sad thing, because at the end after you saw all of these things happening, you just had to kill the frog. But it was a frog and not a human.
Yeah. That is part of public health.
That is part of, yes. The rats, the rats and these kind of things, yes.
Oh, nice. Alvin, we spoke about, so how do you see our future in pharmacy, especially in St. Lucia? How you see things are going to be as it relates to modern technology, a more advanced, stage of pharmacy and pharmacy work, especially in St. Lucia, and by extension, if you know anything about the Caribbean, because I know all pharmacies link up together. Yeah,
so we of course, the pharmacies can specialize in different areas now. Cardiology, we talked about clinical pharmacy, right, where they work with the doctors to actually design special drugs, special regimen for a patient, right? Because not everybody you can give the same thing because of the body and the way that we react to things and the deficiencies that we have. So there is a scope for that, for specialized in oncology, in cardiology, in pediatrics, and so forth. Dispensing for kids is completely different from dispensing to adults, right? And that's why we have the drug monographs, and we have the BNF, the British National Formula, the formularies that gives us guidance as to how the concentration for the children and so forth. But just as you have a general practitioner and you have a pediatrician, well, the same thing with pharmacy. You can have the pharmacy, and you can have a clinical pharmacy that specializes in that area, right? There is scope for it. Of course, can we pay them? That's a different question. We have, as far as I know, about 2 persons who have done the doctoral level in pharmacy, but they're not here. Yeah. They're not here. There's not a scope. There's not a scope for them here. The work that they do and the pay grade the government can afford,
Yeah,
afford
your
it,
pay grade
right?
is- yeah.
So, and just for your own advancement, because if you learn so much and then you come back and what you have to do is just count tablets, then what was the purpose of all that learning,
Well,
right?
not only counting tablets, but
But yeah, I understand that. But what I'm
Yeah.
saying is that it's like you can't practice your knowledge,
Yeah,
right, and,
that's
and so
true.
forth. And for one, you're not going to get paid for it because they're not even a pay grade for that for these kind of specialties. So, but it will get there. It will get there. Some schools like in Jamaica, there are a lot of farm days. I mean, I went to school up there, and every single tutor had a farm day, right? And they work with the University of the University of West Indies, the hospital there, and they do their rounds with the doctors and so forth. So that's the area that they also with the whole AI thing, right? There is a branch in pharmacy called pharmacovigilance, where the persons look at the impact of drugs on on society, on the people who use it and so forth, right? And in as much understand drugs, just as they are, the drug can be taking some cocaine and then they get addicted, right? The drugs that we have can cause addiction as well, right? So you need to be able to monitor that and see what persons are using and how persons are also diverting drugs. Because the one thing that may be good for a particular reason, some persons may be taking it for a different reason, all right? All things like amphetamines and all of these things are drugs, aren't they, right? And LSD and all of the things that the persons are using now, and the party drugs and all of these things that they're using,
Oh, yeah.
right? So these are all areas that there's scope for that and the monitoring of it.
And I think the states have that issue with what drug is it, where there is strong addiction.
Yes, yeah, and exactly, and they develop it for that, right? So that because the pusherman just wants his money. And at first it was the cocaine and the crack and so forth. So as they crack on that, they develop other drugs that persons can use. The amphetamines are big, right? And it's the meths and so forth. And it's really highly addictive, right? So these are areas. We also have. I once went to a workshop with a gentleman from Canada, and he's working with law enforcement to detect drugs. He's using his pharmacy knowledge, right? Because these guys are using existing drugs and they're developing new drugs. They add in chemical bonds to it and so forth for it to make it addictive, right? And so you have to be able to detect it. And because the law enforcement may not be trained in determining what type of a drug, right? But when you're out in the lab, that's okay. You can run the test. But when you're out in the field, how do you know? How do you know the powder that you're saying there is cocaine, right? And so these are areas that pharmacists are going into, and they can go, especially in the metropolitan countries where they have more scope. Of course, you can be an entrepreneur. You could start your own pharmacy. You have your own consulting business. You can work on the in the international field, right? So you work in different cultures, in different countries with different additional certifications, right? You can work for the WHO, right? Yeah, you have to deal with drugs, vaccines, and all of these kind of things. So yes, and of course you can management. You may want to start your own pharmacy, right? You need to have some management skills, right? To be able to make your orders and be able to supply. So these are areas that persons can go into instead of just, if they don't want to maybe stay in the hospital or the community setting. Yes.
Okay, so Alvin, I know we spoke about more in the international context, but in our local context, when we go out there, a lot of people, they take their medication, and as a health educator too, people ask you questions and they tell you how you take the medication. So I have a few little questions that was put together by my colleague.
Okay.
Because when we go out to the health centers and we in the community, many times persons do things and you don't have no justification why they shouldn't do it and so on. So one of the questions, is it necessary to take medication with a big glass of water? So some of them tell you drink it with a glass of water. But some people really don't like water, so they tend to drink it one little.
Yeah,
and that's it.
understand that. Yes, Yeah, well, there's some drugs that it's necessary, but not every drug is necessary. As long as it gets into your system, your digestive juices can break down the drug, right? There are some that is necessary because it better helps the dissolution of the drug, the breakdown of the drug, and also the elimination of the drug as well. There are some drugs that can form crystals, right? And when you have urea, for example, crystallized, you need water in order for it to excrete it, you can't excrete the crystals, right? So you need it to be dissolved so that you can go to the toilet and pee and urinate, or maybe through your sweat glands or so forth. So, yeah, it is a good thing to just drink a full glass of water with your drug. It's the best thing, not juice or milk. There are some that you have to take. You can't take with milk or can't take with. You have to take with food because it upsets the stomach. A drug like Advil, for example, right? You must take it with your meal, or just after milk, or after meal, or when you say with meal, it could be at the time you're eating, or just immediately after, or if you take a glass of milk. It gives you that kind of protective. It protects your stomach and the lining of your stomach from.
And there are some drugs that tell you no dairy products.
Yes, and there are some that binds with that and forms what is called a chelate. It chelates, all right, and form a compound that cannot be absorbed. So it's basically a waste. You took the drug, but you didn't get any effect because the drug has to come out from the stomach into your bloodstream. And in order for that to happen, it must be in a soluble form. It has to dissolve. It's like you have sugar, and you put sugar in water, right? And then you get sweet water. All the sugar, where did the crystal go? Got dissolved in the water molecule, right? And so you have a solution. That solution is what goes in through your cells. As a crystal, it can't go into the cell. It's too big, right? So that's how it works. It has to get dissolved to enter into the bloodstream.
I mean, given the fact that you both were sitting here, just out of curiosity, in terms of which would be less effective in terms of the drug, the liquid or the powdered substance?
Or the tabs.
Oh, yes. So obviously the liquid works faster. Because it's already in the solution that it needs to be. As we said, you can't. Let me backtrack. It depends on the route of administration, right? If you're taking if it's by mouth and it has to go through the gut and enter into the bloodstream, then it needs to be in a solution, right? So if it's already in a solution form, then it just goes right through, right? It doesn't have to get mixed or dissolved or anything. So that will work faster. If on the other hand, a drug like that. Well, in that case, an illicit drug like crack or cocaine, right? It gets, with the powdery form, it gets straight into the nostril, into the cavities here, right? And can enter through through that membrane into your system. It works faster, right? And you will not be able to take it in the liquid form because you'll drown. Yeah, I mean, if you think of you pulling up water in a syringe into your nostril, you get that drowning feeling. So it depends on the route of administration, but generally a drug that's already in a solution form will work faster, will get absorbed faster, and will have you exert its effect much faster.
Yeah. Very nice, Sabrina. So what are the consequences of taking a little extra medication when the pain is unbearable? You know, and then they take one Panadol or two, or a painkiller, and you say, "Why? That kind of pain, to me, that will not."
And something, and I'm sure it's something that all of us have done, right?
Yeah.
Yes. Now there. Or
you don't wait for the 2 hours or the 1 hour.
Yes. I mean, when you have pain, that goes out of the window, right? Because you want to double upon it. It can cause toxicity, right? When you take more than you need, your body there is the dissolution of the drugs, and then there is the breakdown of the drug, what's called a half-life, right? A drug every drug have its own half-life. So if you take 100 milligrams of a drug, and the drug's half-life is every hour, then every hour it will decrease by half. But there are some of them that 24 hours before it decreases by half, right? So if you double upon that, you're getting a double dose, basically. And that double dose can be a toxic level, right? So it's important to understand the science of these drugs, right? The chemistry and the way that the drugs is formed, the kind of bonding that they have will determine how fast the drug is dissolved and so forth, right? So that's an area that we go into, that's the whole study in pharmacy, right? You won't learn that by just going down through Google and just reading about drugs, right? This is why you go to school. So you can anticipate the side effects and the effects of these drugs and how fast it works. And that's why it's about safety. So that's why when the pharmacist tell you have to take it 3 times a day and not 4 times, because if you take it 4 times, you're adding one extra dose, then your body can eliminate within that time. So it just accumulates, and over time you have a toxic level, right? Now it may not be something that happened right away, but there are some drugs that are so toxic that you'll be very, very careful with it, because that one can cause a problem. All right. At the same time, if a lady that is taking the contraceptive pill, right?
Oh,
she missed 1 dose, and she can get into trouble, right?
Yes.
Exactly. So
So
and at the
they
same
take
time,
2.
at the same, now sometimes when they forget, they figure they just double it,
Yeah.
right? It may not be more effective. Sometimes your body can't use it; just eliminates the drug, right? You know, and that still doesn't suffice. It may not suffice for the time that you miss it, because during that time you may have unprotected sex and still get pregnant. You know, so other times it can cause a drug like Panadol, right? Paracetamol.
Yeah.
Paracetamol is a safe drug within its limit. But the killer if you take an overdose, and literally within hours.
Yeah, because when you have things like period pain and these kind of things, Alvin, and you get twisting and turning, I mean, as a woman,
Yes.
when you take 2 paracetamol and you have to wait for 4 hours.
Yes.
Boy.
So please don't exceed more than 12 paracetamol in a day. Do not exceed more than
I
12.
think that's common, you know.
Right. That can kill you, and the doctor will not even know what killed you. It literally destroys, fries up your liver.
Especially for the young girls that are having serious menstrual cramps.
Right. Yeah.
So that's a good advice. For
And when
them.
you take Advil or you take Voltaren and these kind of drugs for these, but it also affects the stomach.
The stomach.
And can cause some serious hernias and so forth on your stomach. Just erodes the lining of your stomach, right? So as you take more than that's the reason that they give you that concentration is because that is the safety level, right? And when you go beyond that, you can put imperial,
I
put
don't
yourself in
think any of
trouble.
us think of it like that. All we're thinking of is this is the pain. We want to get rid
Yes.
of the pain.
But at the same time, if somebody says that they have pain, you should not be the one to tell them that they don't have pain. You don't know how somebody feels, right? And the pain level that they can tolerate, right? Some ladies stay the whole day and you see them, they griping, but they will not take anything, right?
Yes,
And
I don't know
others,
how they do it.
before they begin to, or not just others, men in particular. I think ladies have a higher pain threshold than men.
Yes, we do.
Right.
We can make children. We can.
Yes.
By all means. So,
What do you say in instances where, I've heard it, you get to the hospital for some parameters before being administered
Yes.
medication. First thing you're asked, do you have any allergies?
Yes.
Basically, it's a local sometimes you're not always aware with
Yeah.
allergic
Yes.
reaction and so forth. And then you get the necessary medication and only to know over 2 or 3 day period after consumption, maybe you would have had some
Yeah. A
serious
high,
rash
or high.
effect, maybe,
Yes.
facial problems, pains,
Oh,
and
shortness of breath.
should be said, from that medication, but yes, you know within yourself that you have no allergic reaction that you're not aware of.
Oh, you're not aware of.
And then the medication
Yes.
worked against the odds of that. What do you say, what you do, how, in terms of working with the pharmaceuticals?
Yeah, well, you never really know if you have an allergy, except maybe you encounter an allergy, all right? An allergen, sorry. So you may think that you never had an allergy, and then maybe one day you drank not apple, but maybe pineapple juice, or you drank some, you ate something that had peanuts inside of it, and then you begin to get that rash, and then you get to know, wow, I'm allergic to this, so the doctor will tell you you're allergic to this, so be careful, right? You need to be exposed to the allergen in order for you to know for your body, and the reaction of your body is what is caused the allergy, right? If you've never been exposed to it, you will not know. And that's why you might tell the doctor, I'm not aware that I have any allergy. But now the drug itself has, in the formulation, the compilation of the drug, it has both the active ingredient and it has what is called the excipient or the inactive ingredients. These inactive ingredients, there can be allergens in there, right? That would affect you. Not the drug itself, because you might take that drug, I've always been taking Advil. But when I came for yours, it looked different. It was kind of pink and whatever. It could be the coating that they put on it. It could be the coloring that they put inside of it. It might be where the allergen, not the drug itself, but but whatever else they use to make the drug. Now, and so and as you get exposed to it, then you would know. Unfortunately, there are some that you get what is called an anaphylactic shock. That is deadly. Right? That is deadly, where your body literally shuts down and it just closes down your whole body. You can't breathe or anything of that, so you literally die. If you don't get to the hospital early to get your hydrocortisone, to get your adrenaline and so forth, you can die. You can literally die. So, but the moment that you find out, you need to let the doctor know. They would literally write it on your book or on your chart. Allergic to peanuts, allergic to shellfish, on that kind of thing. So you be very, very careful with that. Of course, when you're pregnant as well, that's another kettle of fish also, right?
Yes.
And there's so many things that can affect you and affect the baby, not just you, but the baby as well. So the ordinary drug that you probably would take for hypertension, because of pregnancy, some of them you can't take, because it will kill the baby or affect the baby in some way. So these are things that, as the science, the doctors, pharmacists, that we know or we study, so that we can ensure that we are not putting you in any danger.
And another common case scenario where persons who come in and be diagnosed for certain things, given medication, they take the medication, they take the alcohol, they take all sorts of things, and they come out to the hospital.
Yeah.
They cry, doctor, that didn't work, I don't know what's happening, I'm continuing to feel sick.
Right. Right. Yeah. Exactly. And alcohol is a big issue for us down here in St. Lucia. Everybody, when I say everybody, maybe 80% of St. Lucians drink, or maybe more.
When I see the red sign on the Ziploc bag, and it says, do not consume alcohol.
Sometimes you get upset.
Yeah, and I'm saying to Alvin, but it's a weekend. How can you say don't consume alcohol with the medication?
Yeah.
So at that time, persons will leave the weekend and start the Monday.
Exactly, and that's and they do that. And it's never good. I mean, you came for a condition. You came to the doctor because you had a problem. And the sooner you can get the prescription to get it filled, the better for you. There are things like antibiotics, you have to get it within the 7 days, or else the situation could have gotten worse. The doctor may have to double the medicine, change the medicine, or anything of that sort. Alcohol is not a tonic. And it's not a water either. All right?
We know that. Sometimes it tastes like juice.
So never. I mean, persons literally asked me, can I drink it with alcohol? I said, no, you drink it with water. Right?
Yeah, you said that to me all the time.
Yeah, and it's not, but it's just things that persons drink. I guess it's social drink or whatever. But there are some drugs it can affect, because some drugs cause drowsiness, and when you take the alcohol, it intensifies the effect. So that if you're driving or if you're operating a dangerous machinery or so forth, that can be dangerous, especially driving. And I've never drunk alcohol, but I still don't know how persons drink and drive. Some persons tell you when they take 1 or 2 drinks, it helps them drive better. I do not know. I can't relate to that.
I don't think so. They think that.
They think that, exactly.
It really impairs their judgment.
It impairs their judgment, but at the same time, it may give them that boost of I can do all, I can do this, I can drive fast and so forth. And that is how sometimes they get into accidents. Yes.
Because I've driven underneath the influence of alcohol, and I can tell you, I would speed up, not even realizing that I'm actually speeding up.
Wow.
Yeah. So the time I would get to
Yeah,
go
yeah,
home
yeah.
would be less
Wow.
from a particular distance.
Right.
So these things happen.
It, I'm not sure if it has any pros,
It
but
gives you some speed.
it
Yeah.
has a lot of cons.
So, speaking about antibiotics,
Yes.
some of the concerns people have is being prescribed antibiotics, because once you go to the doctor, first thing they give you is antibiotics, some of them, that is. And sometimes you've been taking some of the advantages of taking antibiotics and should be taken for a period of time, like for example, six months and so on. Some people still take antibiotics for such a long time.
Right.
Yeah. Is it that's a good thing? What are some of the
It depends. It depends on the situation that they're treating, right? But usually antibiotics are short course, 7 days, sometimes even 3 days, to maybe 2 weeks, right? And it stops, because antibiotic, as the name implies, is a drug that works to either to prevent the growth of or to kill bacteria. Now, an antibiotic will not work for a virus.
no, it doesn't.
It doesn't work for a fungus infection, right? So it does not work for malaria, anti-malarial and so forth. So and even then, some antibiotics are not effective against some bacteria,
Like
right?
nail fungus.
Yes, adult fungus, you don't need an antibiotic
You
for
don't
that,
need antibiotics
right?
for that.
You need an antifungal, right?
Yeah.
Now, sometimes you don't know and you just think everything is antibiotic, but that's just a misnomer, right? Persons use that, but it's not the way. So if you get the flu. Doctor, if you come down with a flu, I need an antibiotic. No, you have a virus. The flu is a virus, right? You don't need an antibiotic.
But they still give you antibiotics.
But they're supposed to give you antibiotic if you get in a secondary infection, because as the virus weakens your system, bacteria. So when you get the mucus, that's a secondary bacterial infection you're getting. But the flu itself is just a watery running of the nose, and you don't need antibiotic at that point. You know, just your Panadol and your antihistamines and so forth will help, right? Cough syrup and so forth. But you don't need any. But if it gets to you, you're coughing up sputum and so forth, that means you have gotten a secondary and so they would have to prescribe it. Now, when you get your antibiotic, it's important that you get it as soon as possible from the time it was prescribed, because the longer it takes, the worse your condition can get, right? Now, sometimes your body recovers, right? But you still stress your body, especially if you don't have a very robust immune system. During the time it takes to recover, it uses a lot of energy and a lot of resources, right? And so your body is weakened, and so another infection can come around, some pollution in the air or so forth, and you can get sick, right? So take your antibiotic. When you start, complete it. Now, what happens is when you do not complete your antibiotic, you will have, I'll use a layman's term to describe it. You knock out the bacteria, but you didn't kill it, right? But it was exposed to a chemical. What do you think? The bacteria multiply really, really, really quickly.
So it develops resistance.
It develops resistance. So the next time, so it develops a resistance. Oh, I've been exposed to a poison, but I survived, right? Here is what I'm going to do the next time. I know exactly how I'm going to shut this door off. I'm not going to keep that window open. You understand me? So the next time when you take that antibiotic, it already have a seal-off window. It's not entering into the bacteria, so it's not killing them. And so you develop what is called superbugs that are resistant to the common antibiotic. Now you have to go to more expensive antibacterial, right?
Yeah.
Which is, you may not even get it down here, or it may be so costly, right? You may have to be institutionalized because it have to be an injection. Now, early on you asked whether it is necessary to take antibiotic for a longer period. Yes, there are times, especially persons with diabetes, whose the sores that they have take a long time to heal, right? It may be inside the bone, which is a very difficult place to get anything healed, right? They may have to be on that antibiotic. They may have other conditions, congenital problems that they may have COPD, right? And they continue to have that bronchitis, right? It's just part of one of the spectrum. And so they need to be on these antibiotics much longer so that they could resolve the problems, resolve the episodes that they have. But usually it's a short-term medicine from 7 days, 14 days, and even sometimes 3 days, 5 days.
So you hear that people use the antibiotics for the
For the period of time,
for
yeah,
a
that
period
is,
of
yes.
time, including myself. I'm
Yes.
guilty as charged,
Right.
you know. And so having said that, I've been way past
Okay.
our, and I know the patients are waiting
Yeah.
for you. Is there any last words you want to say to our public out there?
Yeah, well, pharmacy it's an interesting and a very good profession, and of course we want you to start encouraging your youngsters to study in that field. We have need of pharmacists in St. Lucia. Unfortunately, the pay in the government system is not very good. It's not as good as it is on the outside.
Private
So we
sector.
get a lot of persons when they do go to study, they just stay in the private. But I'm getting older, and maybe not too many years before retirement. So we definitely need persons in Soufrière, in the Cerebral Basin, and even out further afield. We have a need. So children, we would invite our kids to go into the sciences. There are a lot of opportunities in both in pharmacy, in medicine, and medical technology, and all other areas in science that they are need. All right, a lot of persons sometimes gravitate to the hospitality and the business and so forth, and then there is a kind of bottleneck, right, in these areas. But the area of science, medicine, and you want to us to have a good health system, right? You want, when you go to the hospital, you're getting well cared for. You need to have professionals to be able to do that. So these are areas to study.
All right, thank you, Alvin. I think Linda Flavio said, good morning, my friend. Good morning, Linda. Let me say good morning again to all our listeners, especially via social media, persons who might not listen to the program now, but later on listen to it on YouTube. Of course, our everyday listeners from the market, Hotel Chocolat, especially agriculture crew, our bus drivers, persons from Conneries do listen, especially the small shops in Conneries. Good morning to you, and our environment. So I hope that this week goes well for everybody, and that program, especially our parents out there, encouraging our children, not to put additional pressure, but encouraging our children to branch out, like Alvin said, out of the normal business, hospitality industry, and go into a little bit of the sciences, and and try to think of careers that are not very common in St. Lucia, because I started with business and then I branch out into the sciences, and a lot of persons are into sciences even if they don't practice it, but that's the way to go, and the sky is the limit when you do enter the sciences. So again, how you encourage your children. We know this generation, they don't really like school, but it's up to us as parents to guide them. So thank you so very much, Alvin. Thank you so very much, Cabrina, for being here with us today. Rome, thank you again, and also the Soufrière FM staff, and good morning, everyone, again.
All right, good night. We off now? We out?